Like, we love to say disruptive here in Silicon Valley, but that's really what our healthcare system needs. My clinical years in medical school and my internship in family medicine really felt like I was sort of embroiled in this system of sick care and just sort of taking care of patients to make sure they didn't sort of fall off the cliff of not so well to deathly ill. We want to reach people who are not in the clinic. We want to get to people before they come to us with problems. And so I was looking for an opportunity where we could impact at a very different level than we do in the more conventional medical system. So my sister is 3 years older than me, but ended up entering medical school at the same time as I did, and we ended up actually going to the same medical school, which was really fun. And it was nice to sort of have like a partner in crime during med school, but she, very much like myself, ended up feeling very jaded by our medical system and was also really looking for a different way to impact the healthcare system when she left residency. My mom was an anesthesiologist for 30 years. My dad, an emergency room physician, and he's been doing that for 35 years. But my mom, she's like a Cal Berkeley grad, and she's always been like sort of very revolutionary. And after 30 years in anesthesia was sort of like, how did I end up with my head down in anesthesia for so long? And over the course of their, from the start of their career to where they are now, the medical system has changed a lot. And it's changed from being a very doctor-driven system to one that's very business-driven. When we were going into medicine, my mom was just like, just make sure that you're able to dictate the career you want and that you have control over what you're doing. And so with that sort of little piece of advice, and just sort of my mom's kind of like a revolutionary mindset that we inherited a little bit, we were very ripe to leave the traditional system. I was contacted by the co-founders at Nurx who had this really fascinating idea. We try to make access to birth control, pill, patch, or ring, emergency contraception, or Truvada for PrEP, which is a daily medication for HIV prevention, easier. Those are preventive medications that are very safe that we feel patients should be able to access really easily. Our current system doesn't allow people to do that, so Nurx was an answer to that, a scalable telemedicine model that allows patients to get basic care that they need much more on their own terms. So all day I'm writing to patients and responding to messages, and I feel that I actually have deeper conversations than I would if I was sitting face to face with a patient. And we've had patients tell us, like, I feel so much more comfortable talking to you about some of these sensitive things, because also taking away that sort of face-to-face conversation allows people to feel a lot more comfortable and less judged when they're asking sensitive questions about their bodies. When I was coming through medical school and residency, we weren't trained in telemedicine or how to handle patients via text or via messaging. I think a lot of doctors, at first, they're kind of like, whoa, what are you doing? And then when they actually start talking to you about it and thinking about it, they come to agree that it makes sense. When you have services like this that take some of these really basic, simple care off of the traditional clinic's plate, the traditional clinics have more time to deal with patients who actually need to be in there. Telemedicine isn't ever going to actually fully replace traditional medicine, I don't think. But nonetheless, more demand on the system, and our doctor staffing in general as a country continues to be outpaced. We're going to need to find innovative ways to make this sort of really struggling supply meet this growing demand.